So, PJ Gunter is a dear, dear faculty, and I would say just most beloved friend and ray of sunshine at Naropa. Works in as a career development advisor in the Center of Career Life Development. PJ also has a master's in personal finance planning and in human resource development. Um, there's so much more that I could share, but I'm going to maybe just kind of turn it over and I'll just share, I kind of talked on earlier this morning on the social justice underpinnings that we see associated with binge eating disorder that are also, so relevant in many mental health disparities. And I think what the data tends to show is folks who have low socioeconomic status, more hardships in their lives, these tend to be the people who are oftentimes most vulnerable to experiencing mental health issues. And they are often also the ones who go unseen, uncared for, untreated. And I happened to find a talk on, or an interview on YouTube that PJ did on marginalization in finance. And it just, I couldn't not ask for you to speak. And I'm so grateful that you're here and sharing with us. And yeah, thank you so much. I'll turn it over at that.
Thank you, Brenna. And just to footnote that, it probably took me 5 days to respond. I was like, you know, I think when you get an invitation like that, the first thing you think is, why does she want me? Or can I handle that? So anyway, I was delighted. Thank you so much. You know what? I'm just gonna jump right in to the presentation I've prepared. For those of you who are PowerPoint weary, I promise you I've got a few, maybe one chart and the rest are still photos, but they're historical, so and a bunch of quotes. So let me see if I can make this work. Okay, how's that? Can you see the
Perfect.
screen?
Yeah, it's great.
Okay, took me a minute.
We got
Ah,
it.
let me just take a deep breath. This is actually where we began. I don't think too many people know that the Statue of Liberty was a gift from France, and it was to commemorate the emancipation of American slaves. You can see there the shackles. Most people see the torch of freedom, but they don't see the broken shackles and the chains at her feet. Even I just noticed it about 10 years ago. I was bumping around and it was like, did you know the Statue of Liberty has chains on her feet? And they did, they explained the circumstances. And although the physical chain has been broken, the chains that bind African Americans and some others to systemic racism and conditions in money and health disparities are still in place and holding firmly. So this is kind of a look at the unbroken chain, historical roots of modern racial inequity and in finance and health. I am so grateful that you are here now for as long or as little as you choose, whatever you can, just to become aware. I also want to thank Brenna, the visionary and leader of the NourishED Research Summit and her fine nonprofit, for my opportunity to present this information that I almost turned down, but I know people need to know this information. I'm also thanking my parents who are no longer in a body. I'm thanking my husband and my family, all the educators, spiritual mentors, there are too many to mention, employers, and also those who contribute in any way to my journey, a journey which I'm still moving on. So today we are going to talk about an unbroken chain. Unfortunately, the chains still are still intact. It's a chain of cause and effect that stretches back more than 150 years, connecting financial policies of the past to profound racial disparities that we see in our country today. This presentation kind of shows that gaps in wealth, health, opportunity are not accidental. They're the direct result of a coherent, systemic, interlocking web of financial exclusion. We'll trace this chain from the end of the Civil War to the present day and examine the consequences that affect all of us, by the way, and discuss what it would take to finally break it. So this is a quote from my boy. He's actually, Frederick Douglass is my favorite Black history figure. He says, where justice is denied, where poverty is enforced, where ignorance prevails, and where any one class is made to feel that society is in an organized conspiracy to oppress, rob, and degrade them, neither persons nor property will be safe. And so we're going to take a look at that. And we're going to take a look at it chronologically. First, we'll mention the period immediately following emancipation, where the economic foundation for African Americans was denied. Then we'll take a look at the mid 20th century, about, 1930s through the 70s or so, a time of massive government investment that built the white middle class while systemically excluding Black Americans, the formerly enslaved. And third, we'll quantify the staggering disparities that exist today in affluence, education, and finance. I am becoming more meticulous about about substituting the word affluence and wealth. Wealth, as you know, everyone here knows, means overall general well-being. And just because someone has a lot of money doesn't necessarily make them wealthy. So I'm trying to say, okay, affluence, they have a lot of money, but you know, they're not really well in other terms. And then next, we'll connect the numbers to their real world impact on health, family, and overall well-being. And finally, we'll conclude by discussing what a path toward true structural equity might look like and the benefits, both individually and as a collective community. And so our story begins at the end of the Civil War. Believe it or not, there was a brief moment, a window, tiny though it was, of opportunity where the federal government recognized that freedom really did require an economic foundation. I don't know how many of you know, but slavery had a multifaceted economic impact on America. First, it was free labor. And I learned recently that enslaved people were not only property, but that they could also be used as collateral whenever a slave owner was trying to buy more slaves or property or stock in the cotton that they were producing. And, I was like, whoa, worth a lot of money, a lot more than just some free labor. So, anyway, the idea of 40 acres and a mule wasn't just a slogan, it really was a policy proposal to give formerly enslaved families a real stake in the economy. This promise was broken. The political will, the will to do the right thing, evaporated. First, Lincoln allocated some land. Jackson came in, or Johnson, whichever one followed Lincoln, said, hell no, we're taking this land back. So there were 4 million people set free, but they didn't have any capital, no land, no home to call their own, and many of them did not have language. And they certainly had no idea of how the economic system worked. So they had to start at zero, just nothing. Here you are, find your way. Can't pull up bootstraps if you don't have boots. This policy decision and the failure to provide an economic base is the original sin of the modern wealth gap. Moving on, I know this is heavy. Um, so I just ask you to breathe through it. I had to breathe through it as I was creating it and learning things I really had no idea about, things about my own family as well. So, yes, it's heavy. And whatever you need to do to take care of yourself, please do so, even if it means step away. So, sharecropping, it turned out to be slavery under another name. With no land, no options, most black folks, families went into sharecropping, and it really was not fair. It was meticulously designed to further exploit. And here's how it worked. The landowner would provide the land and the supplies on credit, but they set the prices for the supplies and the value of the final crop. So, that kind of doesn't work. At the end of the year, after a season of really heavy labor, the sharecropper would find out that their share of the harvest wasn't enough to cover their debt. Kind of smells like what's going on today in our debt and credit system. This created a perpetual cycle that was just impossible to escape. Kind of like the student loan system for some students, and especially those who are economically disadvantaged. It has rightly been called slavery by another name, and it ensured that the profits of Black labor were hoarded by landowners for just generations. And in Texas, as you know, in Texas learned they were free a whole year late. That's why we have Juneteenth. So they remained enslaved for up to another year beyond the Emancipation Proclamation. Next came Jim Crow's economic order, and it was exploitation just cemented. These laws weren't just about social separation, they were a tool of economic control. Separate but equal, and I'm sure you've heard that in the Plessy versus Board of Education system. It really meant chronically underfunded schools and hospitals and infrastructure for Black communities, along with substandard housing. I'll show you some photos from Knoxville, where I was born, and municipal property taxes. So just not having a job could land a Black man in jail where he could be leased as a forced laborer to a mine or a plantation that was often more brutal than slavery itself. They would leave some workers dead, just dead, and just dispose of the body as though it were a piece of trash. And crucially, by denying the Negro, quote unquote, the right to vote, the white power structure made sure that no elected official would fight these laws and protect Black property or dismantle the system. So, political power and economic power were and are inextricably linked. There's another link in the chain. So the Great Divergence is the part two that we're about to move into. The United States got going on policies that built the largest, wealthiest middle class in world history. Programs for housing, veterans benefits, and social insurance, now called Social Security, created unprecedented opportunity. But this prosperity wasn't for everyone. These policies were designed and implemented with racial exclusion as a core feature, which created a huge divergence in the economic paths of America's citizens. Dougie, that's what we call my dad, who served proudly in the Korean War, came home from the U.S. Army with a GI Bill. He had money to pay for housing, but was excluded for homes to buy. He was also denied entry to college because of attendance barriers. There were no colleges or very few colleges for Black folks back then, even though the government would pay for his education. So I want you to take a look at this picture here where kids are happy growing up, got nice cars, play toys, and then in the background, nice homes, serenity, and compare it to this picture. This is where my mother grew up, and she told us about it. What she neglected to tell us was there were no services such as running water, sewage, pest control. I vaguely remember her mentioning something about a waterman who came a few times a week. But, I'm a kid, teenager maybe, that we had running water, we had sewage, we had electricity. They didn't have any. So I didn't really understand what a waterman was, but that he brought the water to the neighborhood so they could wash, so they could drink, so that they could use a bedpan. So I'm just kind of guessing since she's not around for me to ask that might have been too painful for her to recall and share. But I also looked at the US Census about that time, and I found her name, and it gave some kind of address. You can see the road there is even unpaved, but it gave an address where she and the rest of her family lived. But I had no idea that these were the conditions that she grew up under. She was born in 1934, by the way. So a lot of this is due to redlining. And as we all know here, home ownership is the primary wealth in creation, affluence creation in America. And around the 50s and the 60s, the federal government made this dream possible for millions through agencies like the FHA. But they did so by institutionalizing segregation. I'm going to show you a redlining map in just a minute. It's a map where government officials with maps of the city planners drew red lines around Black and integrated neighborhoods and said they were hazardous for investment. So simultaneously, this cut off all access to the affordable mortgages that were available under the GI Bill, which Dougie got. And the numbers are staggering. Out of $120 billion in government-backed loans over 30 years, less than 2% went to non-white families. That includes all people of color. And this wasn't just a failure to help, it was an active policy of disinvestment that devalued Black-owned property and locked Black families out of building wealth. So, in the map that follows, neighborhoods with even a few Black residents were graded D or hazardous and outlined in red. So, I'm going to show you that map. This is the map, the redlining map. And as you can see, there are some areas that are red, and those areas are deemed hazardous. The green areas are good investments, on down to the blue. And then, of course, again, the red lines mean, oh, we're not going to give you a loan to buy property in that neighborhood. Um, and white folks, you don't need to invest there. So I know some of you may have heard the expression, there goes the neighborhood, because when Black folks move in, the property values went down, and white folks were encouraged to put up for sale signs just as quickly as they could. So the logic behind redlining is just as I have stated, not an implicit bias, it was explicit policy. This language, the infiltration, redlining is the definition, it's the infiltration of inharmonious racial groups. And that was written in the manual, the guidebook for lenders across the country. The presence of inharmonious racial groups, that meant Black folks. It was considered a risk factor equivalent to a factory emitting toxic fumes next door. So this actually codified racism, systemic racism, into the financial DNA of the country. So this again is about the GI Bill, and benefits were handed out by local banks and universities. Again, there were no HBCUs. And so deep racism shut people who wanted a college degree just out. And the veterans and other folks were denied housing, loans, and denied attendance to upwardly mobile education opportunities. So this number here in bullet point, I guess it's number 4, in New York and New Jersey, out of 67,000 GI Bill mortgages, fewer than 100 went to non-whites. So breathe deeply, breathe deeply. I am. We're going to look at Social Security and ACEIV. I'm taking that word specifically from a quote that you'll see in a little bit. The Social Security Act of 1935 was a cornerstone of the New Deal. But even though it was a cornerstone for most Americans, President Roosevelt needed the support of Southern Democrats in Congress to pass it. So they bargained that the president needed to exclude agricultural and domestic workers from the program. You see, they didn't use racist language. They used code words for language, such as we hear in today's political environment. And the reason why is pretty simple. The reason why they wanted them excluded is because they didn't want a federal benefits system to disrupt what they were doing in the South, the low-wage labor economy that depended on a captive Black workforce. The result was that nearly 2/3 of all African Americans were left out of the most important social program of the 20th century. They worked, but they weren't eligible for benefits. They were unable to contribute and build a foundation for retirement security during their prime working years. So here is a midwife, a Black midwife who just delivered and cleaned up a newborn. She wasn't covered by Social Security. And by the way, Knoxville had only one hospital for Black folks. The attending physician during my birth did not record my birth time. So some of you might find humor that I cannot get a reliable astrology chart because I can't provide my time of birth. They didn't note the time of birth for Black babies back then, and I'm not 100 years old. I was born this century. Here's another picture that's quite telling. Who looks joyful in this picture? Nobody looks joyful. The domestic workers sitting there in the terminal might even be worrying about who's caring for her own children. She's caring for someone else's children. She didn't get Social Security. And then here are some day laborers who also were excluded from the Social Security system. When the time came to collect, they had nothing coming. They worked, but they had nothing coming. Here's the sieve where I got that word. The bill is a sieve with the holes just big enough for the majority of Negroes to fall through, the language of its time. The exclusion was not an accident. The damage was done, and another structural deficit in retirement security that exists to this day. I will tell you that I was hired one time at a major corporation in Nashville, and I was hired into human resources. So I had access to all the salary data and the stuff that you find in computers these days, especially during breaches when the information is leaked to bad actors. So I looked into the HR pay scale, and they had hired me in below the minimum level for hiring someone in my role. I was devastated. I still remember how I felt, how my stomach sank, that I was paid considerably lower than my salary wasn't even on the scale. And then some years later, I'm talking maybe as late as 2010 or so, I worked for a company, and one of my coworkers got access to the HR files and the salary data. And she told me, if you're not making 50,000, then they're not paying you right. And that was her way of telling me that everybody in our department made more than I did. I made 48,000. And at that time, I already had a bachelor's, and I had a bachelor's in English. So, I was qualified to do that work, probably more qualified than the rest who had a high school diploma. And I was working on a master's degree. So I was paid below the scale, once again, hired, but not paid. And I'm mentioning this because Social Security, the benefits are based on the highest pay we get toward the end of our careers. So the less we pay in, the less we get back. So again, it's part of the whole system. You're paid less, so you get fewer benefits, less benefits when it's time to collect. So here's just one last shot of a migrant family and how they lived. And they worked just as hard as other people. So the contemporary ledger is it's a result of this history. It's vast, it's pervasive, it's also persistent within the wealth chasm. You can see the chain, it's just not broken. This happens, it has consequences. This happens, doesn't, it has consequences. So I know you can't see this, but I will make the slides available. I'll share them with Brenna, or you can contact me for anyone who wants these slides. I'll just go over a few here. How are we doing on time? Can anyone tell me how we're doing on time? Doing okay?
You're great. We're at 2:27, so
Oh, good. Oh, I see the time up above my slide, so I won't ask anymore. Thank you. So, since we're talking about health and health inequities here today, um, if you ask Black folks, they attribute health inequities to less access to quality care and a range of other reasons. So I'll read some of them off. Less access, as in my case. I don't think I even knew therapy existed until I was probably 30 or 40. So it's not really something back then, it wasn't. Maybe it's better now, but it's not something that Black folks accessed because they were too, I know my parents were too busy paying the rent and feeding four children and paying for school supplies and lunch money to be concerned about some therapy and access to the doctor, except when we broke a leg or something really serious. We pulled our own teeth when it was time for them to fall out. So less access. And then they live in communities with more environmental problems. I know that in our community, they replaced a golf course with a dump. And I could smell the foul air of burning in the dump, the burning the refuse in the dump when I was coming home at 1 o'clock in the morning from work. So in the day, you probably wouldn't know, except it was ugly when they removed the golf course and put that plan in there. But at night, oh boy, you could hardly breathe. So another one is Black folks are more likely to have pre-existing health conditions. One of the main arguments against providing universal health care. And healthcare providers are less likely to give advanced care because people can't pay for it. Most likely to work in jobs with risk for health problems. We all saw that very clearly during COVID. The bus drivers, the hospital workers, the grocery store personnel, all of those frontline workers were exposed more frequently to COVID, and those who could work in white collar jobs or other roles did. They worked from home and ordered groceries. Just it's only been 3 or 4 years. We remember all of that. And then hospitals and medical centers give lower priority to well-being, and then communication problems from language and cultural differences. And there, I remind everyone that it was illegal for slaves and former slaves to learn to read and write. So no wonder there were barriers to communication. So we'll look here briefly at the staggering wealth gap or gap in affluence, which I believe is the most important metric for understanding economic equality in our country. According to the Federal Reserve, and these numbers are 3 years old, so I don't know if they've been updated. It's the most recent I could find. White households bring in about 285,000, and then Black households roughly 45,000. So white households bring in, I don't know, 3 to 4 times the wealth. So let me put it another way. For every dollar of affluence the typical white family has, the typical Black family has just 15 cents. And this gap is becoming wider. It's not being closed at all. And in home ownership, it's about the same. White households have 75% own homes that they then pass to the next generation. And Black households, more do not pass property to the next generation because they don't own it in the first place. And so there's a cycle of educational disadvantage. The inequality continues in our education system because schools are funded by local property taxes. The legacy of redlining directly impacts school quality. I mean, lower property values, less property taxes, less money for schools. And the result is that districts serving mostly students of color get thousands of dollars less per student each year. That means fewer experienced teachers, older textbooks, and less access to technology. And access to technology today is a vital component to forward movement. And I will tell you that in elementary school, I never got a new book in my school. The books I got were tattered. Some of them didn't have covers. And always in the back was big red stamp in all caps written discarded. Discarded. We were using books that someone else didn't want anymore. So for Black students who overcome these K through 12 barriers and go to college, the lack of family wealth means these students have to take on considerably more student loan debt. And this debt as well becomes another link in the chain, delaying their ability to buy a home, save for retirement, and start building their own affluence, still paying back loans with compounded interest. I grew up in housing projects. I grew up in college in Austin Homes in Knoxville, Tennessee. And so as our family grew, we moved to larger apartments. And I tell you this little story that two neighborhood public libraries closed while we were living there. The Murphy Branch Library, which was in College Homes, and then the Carnegie Branch, which was located in Austin Homes. All those children and the library branches closed. I escaped my environment by imagining I lived in places that were pictured in the books I read. I went all over the world. I went to other neighborhoods, just other cities. I went everywhere just by going to the library and looking at some books. So when they closed Murphy Branch first, I cried. When they closed Carnegie Branch, I cried again. I was probably about 4 or 5 years older, but I still cried. So me and my buddies used to walk down to the main branch, which was in downtown Knoxville of the library system. They didn't close that one. We used to walk down there, and that was kind of far. And my mother didn't really want us going that far, but it was okay. We went, and I got my library groove on again. So here are some kids in their neighborhood going out to play, and it kind of looks like they were going to a playground. Here is the school I went to. It's called Maynard Elementary. We had concrete on this side right here. There's a telephone pole and some concrete. And that was where we played outside, and we had outdoor activities like wrapping the maypole and, you know, hide, go seek, the little funny stuff kids do, just being kids. When we outgrew this old building right here, the city added on to the existing structure with this new part right here. The old structure was almost a century old. My mother went there. And then new buildings, as you saw in the previous picture, were built for students in other areas where they paid property taxes. So now we need to connect these economic realities to their human cost. And this is not just about money, even though it may look like it is. Economic policy is health policy. And the health policy of this toll is devastating. Financial oppression is not an abstract concept. It has profound, measurable consequences on human bodies, minds, and relationships. I think the professor touched on what is good for the one is good for the all. And I really want to strongly emphasize that the word depression has multiple definitions. It can be an economic condition that ultimately leads to a state of mind, also referred to as depression. So when you're living under those kind of conditions, it's no wonder you're depressed. Financial oppression also suppresses expression, that expression of wisdom, intelligence, love, inspiration, intuition, all of that, which could have wide ranging benefits for all concerned. Who knows? Couldn't we have a cure for cancer? Maybe, but that cure was in the body of someone who lived under adverse neighborhood conditions, environmental conditions, on and on. So let's take a little closer look at the most tragic price of inequality. It's paid in life, years of life. In 2022, the average Black American could expect to live nearly 5 years less. 5 years, that's a lot, than the white American. Why? The link it's direct. We know chronic financial stress is a powerful psychological stressor. I mean, just look around at the crazy things people are doing because they are so financially stressed that they can't even think straight. Why do you need to hurt somebody? Why do you need to kill somebody? Write somebody into an insurance policy and then murder them? That's that's madness. But that's a psychological stressor of someone who feels like they don't have enough. It also leads to higher rates of heart disease and other conditions. And we happen to know, we can see the evidence that red-lined neighborhoods have higher rates of pollution, even air pollution, sound pollution, like railroads and airplanes. There are fewer grocery stores in my neighborhood in Knoxville right now. You have to walk 5 miles or try to get a bus that's within about a mile of the grocery store. So you can't grocery shop without a car, and there's less access to parks and safe recreational spaces. So the beauty of the natural environment is missing from those areas where it's most needed. And we know you in healthcare are fully aware that Black patients often face a healthcare system where their pain is taken less seriously and they receive a lower quality of care. So it's a matter of life and death. And then there's the historical trauma, part of the psychological saga. It describes the cumulative emotional well being or wounding that gets passed down through generations. There's a woman out there called Dr. Joy DeGruy. And she calls it PTSD, post traumatic slavery syndrome. And she says it's passed down through generations in the DNA. I've heard that thrown around today. That trauma just doesn't disappear. It can be inherited through family stories, learned behaviors, and through some biological markers. When a Black person today experiences racism, it doesn't happen in a vacuum. It lands on top of a very deep, collective, historical wound and systemic conditions, legal system that helps explain why we see higher rates of conditions like PTSD in the community. It's heavy. It's heavy. Definitely invisible most of the time, and a heavy burden to carry. You've seen it in police brutality and other areas I won't elaborate on. So, persistent economic instability has placed powerful strains on families. But the story is not just one of strain. This story is also a story of resilience. In response to these pressures, African American communities have developed and maintained very powerful support systems. These networks with roots stretch as far back as slavery, providing everything from childcare to financial help to emotional support. It's a powerful testament to the community's ability to build strength and face systemic disruption. Okay, we're now down to the thinker, and I sure hope you like that contemporary picture of the thinker. Let's mix it all up and consider. we're getting to the conclusion now, the unbroken chain. The one on the Statute of Liberty, Statue of Liberty is broken, but I really feel like this chain has not been broken. And the evidence kind of points to that. It says the denial of land in 1865 is linked to the exploitative sharecropping system, which is linked to the denial of a mortgage in 1945, which is linked to the massive racial gap of 2024, which is linked to the corresponding gaps in health, education, and life expectancy. It's one long, unbroken chain of causality. The path forward, insufficiency of race neutral policy. Race neutral, what does that mean when we look at each other and then immediately start applying the labels? Oh, she's black. Oh, he's female. She's female. They're trans. Oh, you know how those people are. They're same sex. Just all these labels. Disparities created by centuries of intentional race conscious policies of exclusion cannot be remedied by race neutral policies of general economic uplift. What happened to DEI? DEI had to go because white folks were being discriminated against, and the violin plays. So, in moving toward structural equity, we need to address the wealth gap or the affluence gap at its source. Aggressively enforce anti-discrimination laws if they're there, ensure financial inclusion, integrate economic and health policy. It's totally written out. Invest in environmental justice and provide universal access to quality, culturally competent healthcare. So, if we focus on the societal benefit of full inclusion, it's not about taking from one group to give to another. It's about baking a bigger pie. We can do that. Nobody has to be without. We can think of the immense talent we've lost, the entrepreneurs who couldn't get a loan, the scientists who couldn't get into the university, the innovators who were trapped by circumstance. Racial economic inequity has been a massive drag on America's GDP for centuries. Maybe someone could have already created a car that could fly, or maybe even we could get rid of fossil fuels. There may be a cure for catastrophic illnesses such as cancer. By finally breaking this chain and ensuring that every single American has a genuine opportunity to contribute their gifts and talents, we create a more prosperous, more dynamic, more innovative society for all Americans. This is the work of perfecting our union, and it's a task from which we all stand to benefit. I started by saying that I have all these degrees because I never felt good enough. Never. And the way I was treated in employment and I didn't tell, and my education just continued to affirm that I wasn't good enough. I'm here today because I am healing that and finally feeling that I have something to offer, something to share, and that even though I am perfectly imperfect, it's good enough that I am enough and I have enough to share. So, for those of you who did stick around, I am so grateful that you're willing to receive this information. And there's my contact information, my personal, and I'm also at pj.gunter@naropa.edu. I know this is a lot of heavy information, but It's a history that we have to look at, become aware of if we even hope to build a better future. So, with that, I'm going to leave you with this Zora Neale Hurston quote. Sometimes I feel discriminated against, but it doesn't make me angry. It merely astonishes me. How dare they deny themselves the pleasure of my company? That's how she would have said it. It's beyond me. She scratches her head. And that comes from her essay from 1928, How It Feels to Be Colored Me. And so I'm done. I'm going to stop my share.
Mm. PJ, thank you so much. It's so great to not be the person at the conference with the heaviest content.
It
Oh,
is heavy.
yeah. It is, and it is so important. And I think, yeah, I'm so grateful that you're here and that you're sharing. It means a lot. Um, I have I have like 5 questions at the ready. But I'll kind of open it up to I'll maybe give a starter. And if anyone has any, feel free to put in the chat or raise a hand or just interrupt me. Um, there's so many things that I could touch on that you shared on, and there's so many. This piece is so important to mental health, and the biggest question that I guess that I would offer, and you kind of closed your talk by offering a perspective of look at what we are missing out on, look at the benefits that we could be gaining. And a big one that I always observe is nobody knows resilience, I think, like like our BIPOC communities, like our Black and brown friends. Like, I mean, there was one day, maybe 2 weeks ago, where, I know your content, so I know that this is an experience. I was stuck with my head up my own butt about something, and you sent me just a very, joyful, sunshiny email. And I was like, okay, Brenna, you can still be joyful, you know? Also, this isn't that bad. But so I guess my question is for you personally, and you can broaden this if you want, but what do you find to be helpful or how, and I think this is applicable to a lot of folks, how do you hold these things that are so painful and so hard and still have room for the sunshine and showing up how you do? Like, yeah, any words of wisdom that you have to offer on that?
Well, I meditate every day. And it really wasn't until I started meditating consistently and regularly that I began the process of feeling self-worth. So I really believe that raising ourselves above the level where we perceive we are through spiritual practice, whatever that may be, if it's taking a walk through the woods, watching a bird. Just the day after my mother left her body, I got up and went outside and I saw the most gorgeous red bird out there. And I thought, Mama, we okay. We gonna be just fine. And it flew away before I could grab my camera. So just appreciating our own intrinsic value. Each of us has gifts and talents and abilities to share that could enhance our own lives and maybe for generations to come. My favorite quote, Brenna, is you can count the seeds in an apple, but you cannot count the apples in a seed. So it's all about what kind of seeds do we want to plant? Do we want to plant misery and hopelessness? Or do we want to plant something that we would be happy to give someone.
Beautiful. Thank you. Any other questions? And let me just quick check over to the Facebook chat too. Okay, so maybe this is actually a little bit of an iteration on the same thing. I'm just going to ask it a different way. So for providers, we have a lot of, we have a lot of providers at Nourished and a lot of health providers as well. And I think in the field of eating disorders, but I think also in the field of mental health, often the first point of care, if not the only point of care, might be a health coach or a nutrition coach. Um, who don't necessarily have a lot of training in mental health and maybe who are trying to support clients who have experiences very different from their own. Do you have any wisdom, any words of wisdom there of just, yeah, how can we be of support to others who might experience a lot more hardship than we do?
I think, first of all, a lot of people are working who are more concerned about money and getting money than they are about supporting the patients. It's like, and I don't need to elaborate on that.
Mhm.
I think we all understand that. And yes, we do have to live, but being there for the patient is really critical, getting out of our own head about that. And then just knowing that maybe we don't know what we don't know. Maybe we can't be sensitive enough to understand what this person is going through. Just being willing, being present first, as I said, and being willing to support them wherever they may be. I don't know that training can take the place of sensitivity and compassion.
Beautiful. Yeah, thank you. Kind of harkens back to some of the discussions that we were having in Dr. Koklauskas's presentation of, the humility piece and the, being able to meet someone as a person, and kind of on the journey, which actually has been kind of a theme throughout the presentations today. Beautiful. Boy, thank you so much. I'm um, so grateful to have you here and have your share. It means so much.
Thank you so much. I'm so grateful to share this information. And you may share the tape, the
Beautiful.
recording in all with all its imperfections and bumps and bruises.
Perfect.
It's okay.
Perfect, perfect. Thank you. We've got a little bit more time where I know that Rishi is stepping out of work to present. So Rishi just messaged me and said I'll be on in a minute. So if anyone else has any questions, thoughts that they'd like to add, please feel free to jump in. Otherwise, I'll just kind of blubber on for a couple of minutes.
I do have some chaos in the background with my children, but I just want to personally say thank you. I think so much so much of birth work that's unacknowledged, is trauma that can happen both through pregnancy and the birth and, just not even, you said it as a casual comment, but, not even having the acknowledgement of the time of your birth. I think, like, I just can't think of words more powerful. And how strong that is and how recent that is. And I just wanted to say thank you. It was a very emotional, I kept my camera on. It was a very emotional sharing.
Turns out I was muted. Thank you so much, Alex and PJ. Thank you so much.